The patient wants the best, and that's too difficult. It's difficult because what is the best? And that's for one patient is different than for another patient. And that was the whole meeting about.
ESO Observatories are high-level sessions which aim to provide updated and unbiased information. This session focuses on innovation and care for prostate cancer over the next 12 months, with a panel of distinguished clinicians, scientists and a patient advocate, all providing forecasts for the next year, followed by a discussion. Can you summarise very quickly what happened in the session?
Let's say, for example, MRI. We should make an MRI for every patient before biopsies. I think that's a clear message. Should we do it? We don't know, because there's still discussion. Should you take random biopsies also? So a lot of discussion, but I think MRI first. That sounds reasonable. Then we have active surveillance, and they also nicely had some comments from patients in the room, because I liked it that there were also patients in the room. They said active surveillance is so important. You have to do this. Then we had the urologist talking about radical prostatectomy, and that's our bread and butter, you say, yeah? That we like to do radical prostatectomies. And who should we do it? Well, not in the low-risk cases, that's we agree on, but in the high-risk, we do it more and more. Even advanced cases, even metastatic patients, we do radical prostatectomies.
So John, from your perspective, as a patient's perspective, were you happy about what you heard today?
I think I was there, I suppose, to sell the idea that the profession should be concerned front and foremost with the quality of life of the patient, and I think the sense that patients sometimes are quite willing to trade off some degree of overall longevity for quality of life, and certainly quality of life will improve if some of these things that we heard about today become mainstream.
The most difficult is to make a choice. What kind of treatment should we give to the patient? And I think we have to do it together as urologists or as radiation oncologists, also medical oncologists. But the patient wants the best. And that's too difficult. It's difficult because what is the best? And that's for one patient is different than for another patient. So what is the best? We don't know. And that was the whole meeting about.
EAU TV is brought to you from the 34th Annual EAU Congress in Barcelona. And if you'd like to watch more things like this, then you can click on these videos here. And you can also subscribe for the very best in medicine, from psychology to urology, from gynecology to genetics.